And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we're going to be doing a research review for a new paper that's come out dealing with cervical instability and all of the different symptoms that can be associated with that, from headaches to dizziness, chronic fatigue, and this is specific for people who have been around, had all of the customary tests, CTs, MRIs. You know you're not dealing with tumors or infections or broken bones or anything like that, but you still can't quite figure out what's going on. And this is going to dovetail with a lot of other videos that I have on this particular channel. This arguably is one of the best papers that I have read in a while, partially because it actually gives nod to chiropractic. And this is written by a medical doctor who understands how these different ideas traditionally that we have, that for example chiropractic medicine, no, the two don't mix. No, there is a time where these things need to come together, and when we're working in that way to understand what's going on, that gives us such a better opportunity to be able to help people who otherwise are slipping through so many cracks. So this particular video, that's going to be a little bit more reading than I usually do, but do bear with me. I think that you're going to find the information really, really valuable. Let's jump into it. Now, before I forget, because I usually do, if you've got that friend, family member who is experiencing some of these things that I'm going to be talking about, please share this video with them, and also click that like and subscribe. That way this information can get out to the people who need to be able to find it. So let's jump into this. The ligamentous cervical instability etiology of human disease from the forward head, face down lifestyle posture. Emphasis on obstruction of fluid flow into and out of the brain. This one, lead author, Dr. Ross Hauser. He's got a YouTube channel, and what he does is what's known as Prolotherapy. It is a type of injection to help strengthen the ligaments of, well, really anywhere in the body, but one of his specialties is working with neck-related disorders. Simply put, where the ligaments have been stretched so much that as opposed to them being nice, strong like that, they're now way, way, way too flexible. And as a consequence, people can be experiencing a whole bunch of different things. So let's see how our authors here, Dr. Hauser, Dr. Matthias, and Dr. Rawlings, start out. Ligamentous cervical instability, especially upper cervical instability, upper neck, can be the missing structural cause and or comorbidity for many chronic disabling brain and systemic body system symptoms and diagnoses. Due to the forward head, face down lifestyle from excessive computer and cell phone usage, the posterior, that is back ligament complex of the neck, undergoes a slow stretch called creep, which can over time lead to instability and breakdown of the cervical curve. As this degenerative process continues, the cervical curve straightens and ultimately becomes kyphotic, a process called cervical dysstructure. Simultaneously, the C1, or top vertebra in the neck, moves forward, both of which can lead to encroachment of the structures in the carotid sheath, especially the internal jugular vein and vagus nerves. This obstruction of fluid flow can account for many brain diseases, and compression and stretch the this obstruction of fluid flow can account for many brain diseases, and compression and stretch of the vagus nerves for body diseases, including dysautonomia. So that's just a bit of a broad brush overview of some of the different structures that are going to be involved. In brief, we're talking about something where your neck has been injured. Even if you didn't have broken bone, bleeding, or even bruising on the outside, either one, an old traumatic injury, or B, a repetitive stress injury where you just keep simply doing the same thing day after day, week after week, year after year, that leads to this stretching of the ligaments that starts to screw around with vital life nerves that go from brain down to the rest of the body, but also ability of blood to circulate on the inside. Again, I'm not going to read this whole thing, but I want to hit some of the highlights and add some commentary where I think it'll be useful here. So, talks a little bit first and foremost just about the structure, the nature of the neck. Neck is made of 7 vertebrae. The top 2 of them in particular are responsible for supporting the weight of the head and is going to account for about 50% of all of your head and neck movement. If the joints were not designed the way that they are, we as human beings, number one, wouldn't be able to stand up straight, but number two, we wouldn't have the degrees of flexibility that we do. That said, the body craves a balance between stability and mobility. When the body is exposed to trauma or chronic low-grade abnormal forces, it leads to ligamentous cervical instability. And this does not mean that your head is about to fall off your shoulders. No. What Dr. Hauser is referring to, and the way that we use this term from a medical and even from a chiropractic perspective, instability means stretching. And you can have 3 different levels of stretch. So one is going to be a grade 1 stretch. So this is when you're going to have micro tearing and little bits of extra flexibility. If you do it just a little bit more, this is going to cause a little bit more excessive mobility. Think of it, the difference between you've just sort of rolled your ankle a little bit versus where you actually felt something pop, and then you've got black and blue bruising. That's usually going to be a grade 2 injury. A grade 3 ligament injury, this is where the whole thing actually does rupture. The kicker is that from the traditional medical perspective, instability is only referred to and it's only diagnosed on X-ray or ultrasound or MRI or something like that when you see these full grade 3 tears. What we're talking about here when we're using the term instability is a tearing process. That is, even if it's not torn all the way through, it still is creating and allowing for excess mobility. Ultimately, this broken neck structure, not broken bones, but it's not working the right way, leads to what they are terming cervical dysstructure. And 2 common conditions that are often overlooked by missed or current static supine diagnostic methods. Its incidence is also increasing with the ever-prevalent forward head, forward daily lifestyle of looking at computers and looking down at tablets. What does he mean by this? It means that so many of the different diagnostic procedures where you're looking for pathology are done when you're lying down in a tube, either a CT or an MRI machine. The issue is that we as human beings, we operate the vast majority of our life upstanding or sitting. As a result, we're not necessarily seeing these functional disrelationships with traditional diagnostic imaging. And what we need to do then is we need to make sure that any diagnostic assessments we're doing are going to be appropriate so that we can find what is actually going on. Scrolling a little bit ahead, here's a brilliant picture that's talking about exactly what we're referring to. We spend so much of our life in this position, either looking at the screen or looking down at the phone. And over a period of time, creep then, this refers to where ligament starts to actually deform. And instead of it having that solid strength, it starts to stretch. There was actually some research. This was done on rats some years ago. But what they did was they had rats deliberately, they like hooked them up to a little device. I don't remember exactly how that worked. But what they did was they were on purpose having these little rats move the neck in a way that was not actually overstraining anything, but they did have them keep doing the exact same thing for about an hour. So continual movements, just moving their little necks up and down, something like this. What they found is that even if you didn't push the joint to its end range of motion, doing repetitive tasks actually cause those ligaments to stretch. We as human beings, we arguably are going to do a heck of a lot more of that because of the nature of our lifestyle. And then as things are going to start to stretch, this is going to start to lead to a few problems. This is what he's going to get into next. So we're talking about the overall global curve of the neck. The normal curve of the neck is what's called lordotic. That is forward facing with the apex facing forward like this. And that's called a cervical lordosis. Cervical lordosis maximizes the spine's ability to handle forces, maintains global spinal alignment, and supports and balances the head. In other words, what happens in your neck is going to affect the entire rest of your body. Now, the neurovascular and soft tissue support in the neck is best relaxed. Its innate configuration with minimum tension, which optimizes function. However, if there is a disruption of cervical lordosis, the axial load, that is, center of weight of your skull, shifts forward and will continue to do so until the curve actually goes backward, what's called a cervical kyphosis. The kyphosis can lead to stretching and lengthening of the spinal cord and other nerves that travel in the neck, including the vagus nerves, affecting nerve impulse conduction. Now, I've talked about this in a number of my other different videos, that in brief, and as I already said, when you stretch or straighten the neck out, that's actually going to be stretching the entire length of the spinal cord. Picture, if you would, a balloon with a piece of string attached to it. The balloon is your brain, the string is the spinal cord. Your cord is anchored at the base of your skull, C1, C2, C3, and then it is mostly a freely floating string all the way to where it attaches down at the base of your tailbone at your sacrum. Here's the thing, is if you are always having your head in a forward position, something like this, that's going to start to stretch that string like this. As a result, not only can you experience symptoms in the upper part, so that is your head and your neck, but you can also start to get low back pain, sciaticas, tingling down into the hands. It's what's known as a cervical myelopathy. And a cervical myelopathy is not just a matter where, again, this is happening in the neck, but this is going to be affecting nerve conduction all the way down the rest of the body. Very, very common. People experience severe low back pain, sciatica, things like that. They have an MRI, they're looking at their low back, and they say, yeah, there's going to be a certain amount of disc damage. We as human beings, 60% of people do, because again, we're upstanding, and we bend, we twist, we do all of that sort of stuff. Nevertheless, they do all of the normal treatments, but nothing seems to be working. But nobody's actually thought, could this be a downstream effect because of something that's actually happening up at the top? The pain is not always where the problem is coming from. Now let's go ahead and have a look and see what some of the knock-on effects of that can be. So ligamentous cervical instability is a progressive disorder leading to the breakdown of cervical lordotic curve, a condition we're going to call cervical dystructure. In other words, this doesn't happen all at once. I use the analogy of rusting on the inside of the body. He's going to talk about this in just a moment here, but in brief, this is very, very seldom going to be something that happens all at once. Kind of like if you were to leave a bike out in the rain for a few months, a few years, or a few decades. When you're looking at degenerative arthritis in the spine, that is a process that takes decades to develop. And as a general rule of thumb, the more wear and tear that you see on the inside, the longer ago this process actually started. So yes, degenerative arthritis is more common in older people, but it is not simply because a person is getting older. I see some people who are in their 40s, man, their spine is shattered. Other people who are in their 80s, not too terribly bad. The difference is lifestyle and the accumulation of little physical injuries that start to accumulate compounding interest over a period of time, and it just so simply happens to be that older people are more likely than to have experienced different kinds of, little injuries and repetitive stress injuries in the past. So cervical instability can cause many symptoms. What are some of the initial ones? That can include cracking, clicking, grinding in the neck with movement. Things aren't moving right. As well as neck stiffness, muscular tension, and weakness. That is, feeling like the head is too heavy, and also a headache. What is not well appreciated is that it can, let's scroll down there, and here's a little picture where he's able to show, I'll go back there just a little bit, what a normal forward-facing, so this is the person's face, this is their jaw, normal forward-facing curve of the neck, but this is that process that occurs over a period of time due to either one, traumatic event, or two, repetitive stress injuries. So where we're talking about some of the other knock-on effects that oftentimes people aren't thinking of, that this is related to the neck. Potentially a host of other disabling symptoms, including vertigo, dizziness, tinnitus, migraines, and brain fog. Ligamentous cervical instability causes human disease by two primary mechanisms. It interrupts nerve signals, so that is spinal cord and the vagus, so you're affecting transmission, and also obstructs fluid flow to and from the brain and the body. For another look, just simply put, look at this picture that we've got right here. You've got a variety of symptoms that are all over the place that are neck related even though we're seeing that these affect the brain, these are affecting other places in the body. I repeat, pain and symptoms are not always where the problem is coming from. Now, does this mean that all headaches, all vertigo, all lower back stuff, all brain fogs is going to be because of the neck? No, that's simply not true. That is not the way that the body works. You can have multiple levels of involvement. I simply want to illustrate for you that, especially if you've been having a whole bunch of tests, nobody's figuring out what's going on. Have you had your neck actually looked at? Now, I'll continue on here, that in the cervical spine, the body will always choose stability over motion to protect the adjacent neurovascular structures. This is why long-term osteophytes form, and eventually osteoarthritis causes a limitation of motion. I repeat, degenerative arthritis, osteoarthritis, is not simply because you are getting older. Your body is laying down more bone because the muscles, the ligaments, they're moving too much. And it knows by putting little bits of calcium deposits that that's going to provide the stability that it needs. Otherwise, the consequences you can see here can be pretty severe. But the kicker is it doesn't matter how good your diet is, how much you exercise, or how strong you are. If your body needs to compensate for something that is not moving the right way, it's either not moving enough or it's moving way too much, there eventually comes a point where it's essentially like, dude, we can't do this anymore. And that's when we start to experience some of the really nasty stuff. And people will oftentimes say, but doc, I didn't do anything to cause this. And you know what? They're partially telling the truth. There wasn't anything in that day that necessarily brought on their symptoms. Maybe they just moved their head the wrong way, something like that. But far more likely, that was simply the straw that broke the camel's back. That was the last bit of stress where body just wasn't able to compensate anymore. And as a consequence, after that point, it's on. And here's just a small picture that can illustrate how and why that can happen. So what you've got, and as he's alluded to, that the issue, it's not in and of itself, it's not the bone and it's not the ligament, it's soft tissue structures that's in its near proximity. So what you have right here are, you have the pair of arteries that are going to be supplying the bulk of blood flow up to your brain. The vertebral artery passes through the neck and through the top bone in the neck here, and your internal carotid artery is going to transverse right up the front of that bone. Kicker is if it's, again, either A, not moving enough, or B, moving way too much, then it can start to affect circulation up to the top. It can also affect circulation coming back down. This little guy here, well, big guy right here, this is the internal jugular vein. This is the one that usually is draining blood from the base, or from your skull down to the rest of your body when you're in a lying down position. But same thing, is if you've got an issue in the neck, either moving too little, too much, it can actually start to interfere and produce obstruction with that flow. This is something that we can actually see very commonly on MRI, and we can also see evidence for this on a cone beam X-ray. Short of it is, if you see narrowness of that upper vertebra in the top of your neck relative to the back of your jaw, or more appropriately what's called a styloid process, you know that those structures are going to be on the inside there. That then is like trying to fit your foot into a shoe that's going to be half of a size too small. And even if blood flow is not being fully obstructed, if it is being obstructed by even 10%, over a period of time, remember, compounding interest. Let 10% compounding interest accumulate over a period of time. People are going to have problems. So that's blood flow going up, blood flow going down. But you can also have issues with circulation on the inside. This isn't my favorite picture, I will admit, because it's very, very rare, and I do mean very, very rare, and this is the kind of thing where a person is starting to deal with paralysis, where you see either the bone or the disc actually physically compressing the cord itself. The vast majority of the time, that's not what's actually happening. But what I do want to illustrate for you, it's not so much the cord itself, but the blue stuff that you see around the cord. This is your cerebrospinal fluid. It's the medium that your brain and your cord exist in so that things can actually circulate on the inside. The problem then is that even if the cord is not getting compressed, if you have narrowness of the space for that fluid to flow on the inside of the nerve canal, that is going to mean that this area is not getting its normal nutrient supply, and you can start to have symptoms associated with that very particular area. Now, yes, you sometimes will see signs of cord compression, and even if it's not getting compressed, again, balloon in the string, if it's getting stretched even a little bit, that will affect the way that the nerve is going to fire. But more often than not, we don't see that that process is happening. What we're seeing instead is that there's simply put not enough space for the fluid around the cord to be circulating, and that's what the actual issue is. So how do we actually find this kind of stuff? Two things. Number one is either DMX or a cone beam X-ray. DMX is essentially, it's an X-ray, digital motion X-ray, where you are taking things in flexion extension views like this or side to side if appropriate, and you are measuring to see, are the vertebrae moving too much? In brief, if you're looking at a normal neck as it's going to be flexing and extending like this, the integrity of the ligaments should mean that the bones still relatively align with each other. However, if something's been overstretched, you're going to start to see far too much movement. This can be done also with static X-ray views. It's less common, but also very important when you're dealing with these kinds of things. So I do this commonly enough in my own practice. So that's the way that you find if something is moving, simply put, too little or too much. What you also can do is what's called a cone beam CT or a cone beam X-ray. This is not like a standard CT scan in a few ways. Number one, there is way less ionizing radiation. It's a very different kind of technology from a traditional CT. It actually uses less radiation than a normal X-ray, and you get these absolutely beautiful 3D reconstructions where you can see, is there evidence of joint misalignment? You can see the structure and integrity of the C1, the C2. You can pivot around to look for other anomalies or other structural variants that can possibly be contributing to the symptoms. So that's the first advantage with the cone beam X-ray. The other one is that it's done in an upright position. Remember what we said at the very beginning of this video? That a lot of standard diagnostic procedures such as MRI are done lying down. As a result, you don't necessarily see the functional disrelationships about what's actually going on. When you're doing your analysis in an upright position, though, then you've got a lot better chance to figure out, one, what's going on, but two, what do you need to do to actually help this out? So that brings us then, what do we need to do about this? So check this one out here. Successful treatment is determined in large part by correctly identifying the underlying cause of symptoms and diseases. When the etiology is presumed to be structural in nature, treatment becomes directed at the dysfunctional structure, and it will be more likely to be successful than chemical ones. Simply put, well, there's a few things to this. Number one is the nature of diagnoses. All diagnoses are actually effects. So you have entire books that are this thick that list all of the different symptoms that people can experience. But the question is, why? And where is it coming from? Again, in the first place, that is honestly a lot harder question to answer. We can nevertheless divide the majority of human ailments into three common origins. One's going to be mental stress. There's something psychologically that's going on. That's number one. Number two is chemical. So there's some kind of a physiological imbalance, and a chemical problem requires a chemical solution. The other one is that you're dealing with something physical. There is a structural problem that's going on, and structural problems require structural solutions. What Dr. Hauser's point here, simply put, is, as he's describing the nature of cervical instability problems in the neck, these are physical or structural problems. In other words, medication by itself will not solve the underlying issue. Yes, it can help manage some of the symptoms, but a physical problem requires a physical solution. That's what he says right here. A structural treatment program would therefore be necessary. Now, the components of this program because there's not a one-size-fits-all. This requires a few different approaches depending what people actually have going on. This can include dynamic orthoneurological, let's scroll down there a little bit, that is chiropractic adjustments for vertebral subluxations, curve corrections by chest and weight heads, and also therapeutic exercises and prolotherapy to tighten injured or incompetent ligaments. Let's have a look at what each of those actually mean. Okay, number one, upper cervical adjustments. This is chiropractic care. The virtue and the value for chiropractic, this is when we're looking at joints that are not moving enough. This isn't a case where the ligaments are moving too much. This is a case where a person's had some kind of an injury, and as a consequence, the vertebra is no longer moving as much as it should be. What happens, and this is the body's innate adaptation for these kinds of things, is that it starts to cause other muscles and ligaments to overcompensate. So oftentimes, especially with issues between C1 and C2, C1 and C2 is oftentimes a compensation for something that is not moving well enough, either just above or just below. And if that's the case, what you need to essentially do, it's not literally like this, but you need to get something unstuck. You need to get more motion into the system so that things actually have that opportunity to settle down. So misalignments, especially of the atlas and axis, have significant effects on compressing the carotid sheath. Why? Because vast majority of the time, and he's going to say this in just a second, that the vertebrae are going to misalign forward. I did some of my own research on this a few years back where I looked at 300 consecutive clients, and I just simply looked what was showing up on their diagnostic scans. I found that 79% of the people, the top vertebra in the neck had misaligned forward, and for about 59% of people, the C2 had misaligned forward either independently or as a compensation. Reason that this is important here is that so many different manual manipulative therapies, they focus on thrusting things from back to front. But that can be the right area, but the wrong direction. If something is actually misaligned and gotten jammed up, locked forward, you need to change that angle and make sure that you direct it back. This is one of the reasons why in upper cervical practice, we lead with doing diagnostic images, because unless we see, can know, and can measure what exactly is going on. Which way has the vertebra locked up? Which way is it not moving? Which way does it need to go? And then how do we tailor the adjustment based on a person's individual anatomy? We are otherwise left guessing. And I know this can be frustrating for a lot of people, especially if they've already had CTs, they've been to a chiropractor, they've already had, standard kinds of x-rays. Remember, standard x-rays are looking for broken bones, gross dislocations, degenerative arthritis, and other weird stuff. We as human beings are all different on the outside and the inside. To give and to provide a proper diagnosis and proper assessment about what needs to be done, you need to tailor the angles to the individual. That way you can see what's going on, what do we actually need to do. So these can usually be easily diagnosed on DMX. I will also add on cone beam or on DAX, so digital articular x-rays. We do both of those in our practice here. They can compress the carotid sheath on the side of rotation, and it can also get worse with certain head movements in certain positions. So firstly, that's the chiropractic side of the equation. The second side of the equation, this is arguably also chiropractic, but this also blends in a little bit more with physical therapy. This is where what you're doing is you're working to restore as much normal neck strength and also flexibility as you can, because when that neck curve, again, normally forward facing like this, straightens out, you need to be able to reflex it back like this. So this involves doing two things. Number one, stop looking down at your phone and your computer as much as you do every single day. Number two is taking deliberate actions to make sure that you're bringing your neck back and you're doing something that's going to restore the curve in your neck. Cervical curve correction can be as simple as changing one computer setup to be looking up rather than doing things where they are looking down. It can also be modified by changing your sleeping position. If you can't stop all the stuff that goes on in your day, if you can at least make the effort to make sure that you're going to be able to sleep better at night so your body can recover, that goes a long way towards providing the stability. In their opinion, lying on a cervical orthotic such as the Denerol or using patient-specific weights in a standing or weight-bearing position can also help. A Denerol is a device, it's made of a hard foam that essentially is restoring the curve in the neck over a period of time. Now, I will add that I'm personally not a fan of the Denerol. I find that it is a little bit too firm for many people. And again, when you have one area that's not moving enough, you have other areas that are probably moving a little bit too much. I find that a Denerol has a tendency to produce a little bit too much stress and strain for the majority of people. I mean, some people, yeah, they absolutely are going to need it. But I instead use a more measured approach, using a slightly different device that's got a little bit softer support and then ramping up the intensity to the individual rather than jumping in the deep end and going, full bore with the hardest one that you can possibly use. I'm also a firm advocate, simply put, of lying down flat on your back 10 minutes a day. Dentists have done a brilliant job of letting people know why you need to brush your teeth every single day. It's so that you don't get cavities. It's so that you don't lose your teeth. But chiropractors, we have done a terrible job of letting people know what do you need to do to take care of your spine. The stupid simplicity of lying flat on your back 10 minutes a day. Not only is that good to decompress your neck, but it also decompresses the joints of your lower back. If you start that from when you're a wee little kid all the way till you take your last breath, you will maintain a huge amount of the strength, the stability, and the flexibility of your whole spine. Is not even funny. Does that mean that stuff still can't happen? No, stuff of course can still happen. You can still get cavities even if you do brush your teeth, but it goes a long way toward protecting things. The last one now, this is Dr. Hauser's specialty. This is where the ligaments are, simply put, moving too much. And think about that. If you are a chiropractor and your job is to find something that's not moving enough, you need to get it moving more. The last thing that you would ever want to do would be to adjust into a part of the spine that's already moving too much. I have to admit, I have made this mistake in the past, and guess what? People aren't very happy with me. I tried to do my very best that I can to make sure that that doesn't happen, but I'm a human being. We all learn things as we're moving along. And for those people, if I could give you what I know now versus what I knew 10 years ago, or if I could give people now what I will know in 10 years, I would do that in a heartbeat. Simply put, is if something is already moving too much, the last thing that you would want to do is to make it move more. And this is oftentimes the case where people are trying to twist or crack their own neck. What they're doing, whether you know it or not, is that you're producing too much movement through spots that are already moving too much. You need a different approach that's going to allow things to strengthen back up. This is what prolotherapy is designed to do. Simply put, it's an injection into the ligament with a slightly noxious substance, not like a poison or anything like that, but just something that's going to be a little bit of irritation that's going to spark a healing response. And over a period of time, allows those ligaments to start to get stronger. The body left to its own devices, at best, can only ever get back to 70% of its original strength following either an original injury, like a major trauma, or a repetitive stress injury. The kicker is if you're dealing where those ligaments, wow, they've been very, very flexible for such a long period of time, it can lead to what's known as a physical amplified, like, molecular protein pattern. In other words, things don't ever heal up, they just stay loosey-goosey. So it's going to take another intervention to actually allow things to actually heal up the way that they were supposed to in the first place. Also, because ligamentous tissue by its nature is often slow to heal on its own due to a lack of blood supply, it explains why people can get so many of these troubles in the first place. If you've ever heard a professional athlete say, I would rather break a bone than sprain a ligament. It's because they know you break a bone, you're out for 6 weeks. You rupture a ligament, you could be out for months. The same thing goes, not only is this the nature of how issues develop in the first place, but it also means that when you're dealing with ligamentous injuries, it's going to take time for those things to heal. As much as we wish that we could say, here's the magic exercise, here's the magic adjustment, here's the magic injection that's going to fix everything on the very first shot, we live in a world with time, gravity, and stress. We don't get to heal from things instantly like that unless your name so happens to be Wolverine. Our body takes time to heal, and it usually requires repetition. Nevertheless, if you can get to the true origin of what's producing these problems in the first place, it gives you and your body a much better opportunity over a period of time to let things start to heal the way that they are supposed to. If the things that have not been moving well enough are now moving better, if the things that were moving too much are now moving more the way that they were originally supposed to. And as things start to calm down, as you make the effort to make sure you're maintaining your strength, your flexibility, your motion, your stability, and not continuously doing the repetitive kinds of stress activities that created the issues in the first place, you've got a much better opportunity of healing, of feeling better, getting your life back. That's what I've got for you. Again, a lot more reading than I've done on a lot of my videos more recently, but this here, an excellent article, and it's written in plain English. A lot of research, it's a mouthful. You need a PhD to understand it at the beginning. This one is available for pretty much anybody. So I hope that by taking the time to walk you through some of the highlights here, this is going to give you a lot more information so that you can, if you've been looking for answers, have a clearer idea what direction, what path you need to go. Again, there's still some testing that needs to be done to figure out what would be the most appropriate treatment for you. And there's not a hole-in-one, and there's not a one-size-fits-all solution. But if you can narrow it down, physical problems require physical solutions, gives you a lot better opportunity to start feeling the way that you really want. So thank you guys as always for watching. If you did enjoy this one, please do click that like and subscribe. Share this one with your friends, family members, clients, colleagues. And if you want more information, you can check out my clinic website, clearchirospokane.com, where us as a team, we have a link to a whole bunch of other blogs, other articles, research, and also check out the other videos on this YouTube channel that may be able to give you the information you're looking for. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.